Perfect.
Excellent. We'll start the recording. That way, you can also go back and view the recording from today, and you'll be able to get access to that. And our guests today are again committed to sharing whatever resources that you need to have to get through or to reutilize the work that we're doing today. So welcome again. Thank you for joining us. Thank you for being here. If you want to just hop to the next slide, Jake, we'll just do a quick little introduction and a reminder of who we are at UW-Madison Division of Extension at Health and Wellbeing. This is our MCH team today. Today on the call, we have myself, Danette Hopke. I'm the program manager for the behavioral health program area. We also have Jen Braun, our health equity specialist. Debbie Moellendorf is our health and wellbeing educator. Jake Rademacher is our graduate student working with us. And Amber Canto is our institute director. So we're all incredibly grateful for this opportunity to support you in your MCH adolescent wellbeing work and to be a part of this process and share the great resources and work that we have as well through our work at UW-Madison Division of Extension. You can see at the top of this slide our email address. We're just going to remind you multiple times throughout the day today of how you can best get in contact with us. If you have technical assistance requests, the most timely way to get a response to those requests is through utilizing that youthhealth@extension.wisc.edu email address. So please do not hesitate to reach out to us in that manner. Our agenda for today will again, we have just a really quick update that I'm going to pass along to all of you from Maggie. We have the Patch team with us. They are our guests. They will take up the bulk of our time today. We'll spend some time also talking about our office hour sessions that are coming up, our newsletter, provide you an opportunity for additional questions. And then also we are going to ask that you hang on till the very end of the call so that we can share our feedback link. Your feedback to us is very important. It is how we adjust our office hour sessions and identify topics. It's also how we adjust and adapt the technical assistance on these learning community calls so that we can best meet your needs with your feedback. So please stay on till the end so that we can share that link. We'll also provide you a follow-up email that will have some additional resources and links as well after our call today. And again, the call is being recorded, so you can go back and view this recording at another time as well. All right, I have a quick update from Maggie. She's unable to be here today. I think it's actually her birthday, so I know she's taking some time off. But in conversation with her, we recognize that there are several technical assistance requests or questions that came in via the DHS reporting and survey that was recently done. So Maggie wanted to share with everyone that the new youth engagement evaluation tool replaces the community engagement assessment tool. So she just asked me to pass this information along. That's the tool that was previously used, and the new youth engagement evaluation is what the expectation is around and what that assessment looks like. She acknowledges that there might be some confusion due to that CEAT tool being referenced last summer when the MCH objectives were sent out to all of you. So again, just to provide some more clarity, no longer needing to utilize that community engagement tool. Instead, you'll be utilizing that youth engagement evaluation. Is that tool? And then also an opportunity to provide shared learning around that tool. So at our July office hour session, which is scheduled for July 13th at 9 o'clock in the morning, we're going to remind you that later today as well. We'll also get it by email, but we will be focusing on the youth engagement evaluation tool during the July 13th office hour session. So I also want you to know that if you've reached out via that survey with a specific question around technical assistance with that tool, we'll be engaging with you directly to clarify your questions, to prepare for that July office hour session, and then also to provide you with the assistance that you need to navigate those expectations. So stay tuned. There'll be more information to come related to that youth engagement evaluation tool that will be coming out. I do see a quick question in the chat. Do all MCH adolescent wellbeing sites need to complete the tool? The answer to that is yes. But the information from Maggie is different depending on your level of youth engagement. So again, we'll provide some further clarification related to that. And in our follow-up email to this session today, because we don't want to take too much time away from our patch guests, we will provide some really clear and specific language that Maggie sent to me in an email. We'll provide that all out to you via email in our follow-up email from this call today. All right. On that note, I am then going to turn it over to Jen Braun, our health equity specialist, and she is going to provide an introduction today to our guests.
Hello, everyone. I am so excited to have today on the call with us, Erica, the Director of Youth Engagement, as well as Shanyce and Jayvyn, to give us more information about Patch's work. But a quick intro to our work with Patch. We are collaborating with Patch to create a youth wellness committee as part of our MCH technical assistance. So what the young people are going to do is get together with us. We're going to meet once a month. We're going to use a framework that UW Extension has developed to kind of guide the young people through the process to create policy systems and environmental changes around health equity issues. So with that in mind, I'm going to hand it over to Erica.
Hi, everybody. We are so excited to be here with you. I'm going to share my screen really quickly, just to kind of help keep us on track. And I feel like we should be in a good spot. I'm also going to attempt to troubleshoot the background. Poor Jayvyn is having a heck of a time with tech today and couldn't download some of the materials in advance. So we might be troubleshooting in real time with potentially some materials from last year's programming. But for now, hi, I'm Erica. I use she, her pronouns, and I'm the Patch Director of Youth Engagement. We're excited to be here today, really talking about a variety of things, including actively and effectively engaging youth and adolescent health work in your workplaces, basically. And I will just kind of move on immediately to introductions. I'm our Director of Youth Engagement. I've been with Patch for going on 8 years now, and I'm based in Madison, Wisconsin, and have both overseen our Madison Teen Educator program that I'll talk more about, as well as I partner statewide in Wisconsin with our other youth programs. Shanyce, do you want to give us an intro of who you are?
Sure. My name is Shanyce Hutchinson. I use she, her pronouns. I recently graduated from Sun Prairie West High School, and I'm going to UW-Madison to study in global health and in biology. A fun fact about me is that I played the tuba in high school.
Incredible. I love that. Jayvyn, how about you? Oh no, did we just lose Jayvyn? I literally just lost Jayvyn's visual.
Hello.
Hi.
Am I good?
You're good.
Okay. I'm Jayvyn. I'm an up-and-coming senior at Middleton High School. And I guess as Shanyce, I plan on becoming a social worker after high school. And one reason why I joined Patch is because seeing as I want to be a social worker, I feel like everyone deserves justice when it comes to healthcare and other like areas like social work. And I feel like I want to make a change in that area.
Awesome. Thank you so much. And I'm also pinning Jayvyn, Shanyce, and I so that you can see the three of us, because we're going to just kind of have a conversation today and hope to do some interaction. I'm so excited the two of them can join me. We've worked together what feels like forever, I guess only 2 or 3 years, but like I feel like I've known you all for quite a while, Jayvyn and Shanyce. So today we're going to describe Patch and explore with the partner to enhance your work. I think some of you are really familiar with our work and some of you are probably brand new to it, so I'll make sure you know what we're doing. We're going to talk first, actually identify what makes youth engagement approaches successful from our adult and youth perspectives. We'll develop some tools to engage with youth from your community. So we're actually going to preview some of our workshops that share a couple tools and tips and tricks, and think about ways youth can be centered and involved in their own care. We want you to have background. We'll talk about all the partnerships. They're going to do some acting for us in that preview. And then we are going to wrap with a Q&A from the team. So feel free to like pop in, drop stuff in the chat, anything like that. But no, if there's things we don't get to right away, we'll get to them at the very end. And I'll say, Jen, if you can flag me if there's anything, then I don't have my chat up. So if there's anything that comes up in the moment as we're going through that you're like, talk about this now, that would be great. So diving right in, Our Patch mission is to improve adolescent health and well-being alongside and in true partnership with youth. And our vision is a supportive environment in which all youth are healthy, connected, and thriving. And so to us, that healthy, connected, and thriving piece means that youth are able to reach optimal health, safety, and well-being, that youth have strong connections to and a communication with peers and trusted adults, and that youth have the knowledge, skills, and opportunities to flourish into adulthood. So it's kind of our basic, our foundation, where we are starting off the ground from at our Patch program. And we specifically are working towards those things through our model for youth engagement. The model utilizes youth-driven programming that is centered on strong and meaningful youth-adult partnerships and integrate these key components of employment, education, and empowerment. Basically, youth are encouraged to be involved in decisions and giving opportunities for feedback, and really see their changes as a result. And so I will talk more in depth, but we provide consulting opportunities, focus groups, evaluation, performance feedback, and so many other things. One of the other things I like to do here is just kind of define this idea of youth engagement. Like, what do we mean when we're talking about youth engagement? And one that we really love is from ACT for Youth. And it says youth engagement is when young people are involved in responsible, challenging actions to create positive social change. And this happens through development of meaningful youth-adult partnerships. And that one I think is one that all of us at Patch have really liked, because youth are doing really meaningful work, that meaningful piece of it, alongside adults with whom they have a meaningful relationship. And they really go hand in hand with one another. So often when I tell people I work for Patch, which is a youth program, I think a lot of people really assume that that means youth run everything and the adults are kind of just there for behind the scenes support. And in reality, this youth-led space can be really powerful, but we've also found some of those like over permissive practices where adults are fairly removed can lead to youth getting stuck or not feeling as though they're able to create any impact or as much impact as they might want. And then on the other hand, I think many youth are part of adult-led spaces that again can be really powerful, but we also can see them sometimes as over-controlling, and it doesn't necessarily lead to empowerment or growth for youth because there's not necessarily that empowerment pit. It's like they show up, they do the thing, they leave, they show up, they do the thing, they leave. Adults control all of those things. So at Patch, we really aim for this youth-driven middle ground. Again, that responsible youth engagement where youth are involved in some decision-making, but they also have the structure and guidance at every point in the process. I like to think we really set youth up for clear expectations and guidelines, but we also don't let them fail in those. So while we've set high expectations, we're going to support them along the way in our meeting in the middle, sharing accountable equity, and those appropriate expectations and boundaries together. So in our model, they're working with the guidance of a trusted adult leader towards very clear impact. They know the job when they come in. For that, in our job structure, youth go through a robust interview and hiring process like they would in any job. Once they're trained, supervised, paid, and held accountable for their work throughout the years, we just get to scaffold this foundation for leadership and opportunity in that way. And it's a little bit different than other jobs that young people might have because they're created to see them thrive. And we can tweak it to see youth succeed all year. I'm trying to think if there's anything else here that I want to hit on. I guess the other thing that youth are encouraged through relationship with their adult coordinator to bring creativity, insight, and ideas for program improvement, participation, and growth. And they often participate in shared decision-making throughout that year. And so while we set the structure, they are changing it, nebbing it, and we're just kind of like a river flowing along together as we see our opportunities thrive. I think the other example of this in ours is, so our youth go through training and enrichment, which are topics that ultimately the coordinator sets and picks, especially at the beginning of the year. It's really structured. And then those topics and areas of interest are tweaked throughout the year. As I hear Shanyce say casually to me, this has been going on in my school, I'd love to learn more about it. And I say, okay, cool, great. Let's create an enrichment meeting on it. Or Jayvyn and I are talking in the car ride on our way to a workshop about like this thing somebody asked us about that we know nothing about, either of us. So we're going to figure out a way to learn about it. And so it is happening alongside one another, really genuinely. Jayvyn and Shanyce, in whatever order you would like, thinking about this idea of youth-driven programming and some of the things I just described, how has this program structure worked for you? And or like what aspects stand out or were important for your experience with Patch? Go for it, Shanyce. I see you waving and ready to go.
Well, something that I really love is that I have other jobs beyond Patch, but I really feel like this is the first time I get to have a shared space between adults and like myself. I don't feel like there's truly an age gap, but rather somebody who's like looking for my best interest. And it's not really all about somebody who's scolding me or someone who is kind of just enforcing a bunch of knowledge at one time. I feel like we're learning together, kind of like what Erica was saying. It just feels like a comfortable space, which I think not many people are able to achieve, especially when there's an age gap between adults and teens. It's kind of hard to have that connection, but I think Patch does like a wonderful job doing that. Yeah, that's like what I wanted to say.
Yeah, I love that idea of like it's kind of flipping this power dynamic and like leveling a power dynamic that does exist by age or experience or pay. I mean, and I think that's also like we make sure you all are paid as teams. Like you are employees too. We are all here together doing the same work. I love that, Shanyce. Jayvyn, how about you? What worked for you in this? What stood out to you?
Really like following what Shanyce said. It's comparing like my regular like after school job to like Patch. Something like if I like show up like 10 minutes late to like my shift, like it's kind of like I'm getting hounded. It's like, why were you late? And not oh, how can we prevent it next time? Or like if you show up late to an enrichment meeting, it's like you're here in the present, you're gonna learn now. And like there's no like thinking about like I can't remember like what's the phrases, but like not reminiscing, but like just hounding you for like being late. Like you're gonna live and do what you are doing right now and learn. And I think that's like the biggest difference and like the easiest way to like not only make your youth want to come back and like keep like doing what they're doing, but just to make an all around happier environment and community.
Yeah, I love that. And I think, I mean, I feel blessed that Jayvyn and Shanyce get to be here because we've worked so close together. And I think with both of them, we've had unique moments of troubleshooting to like maintain engagement or enhance engagement of like, I see you all want to do more. How do we do that together? And you will likely see that on this call. Like I said, we're figuring out even some tech and access to materials issues in the moment. I think 2 years ago, I presented with another team who was talking a lot about, you know, in a lot of these youth ed spaces, wishing the adults would step in a little bit more, even if they didn't take over, but just like they wanted to do a tutoring program in their school club, for example. And they're like, we had all the ideas, and we just like didn't know where to go. And our advisor was like, but you're the leaders, take it and run with it. And I think that was a really interesting experience kind of in a counterpoint. And then she was like, yes, I also do this youth symphony orchestra where I show up and I play my thing, but like, I'm less committed. Like I'm committed to myself and my growth in this, but I'm less committed to the org and the responsibility piece because I don't own any of that. I'm not doing anything unique with that. So yeah. And then you've probably heard me say youth adult partnerships several times in this moment. And this is really at the center of what we do. It's why we can be youth driven. And our youth are hired, trained, and supervised by a local professional that is really specifically trained in our Patch model for youth engagement. I got the privilege of working with Jayvyn and Shanyce, and then they've had another coordinator since then who has worked really closely with them. That person develops a really close relationship with the youth, offering vulnerability while setting clear boundaries, which can be hard to do, but are really important in conjunction with one another. And they're partnering with youth in these community change efforts and working side by side really with transparency. So it's not about us showing up as adults, as real humans with youth. We are asking to show up as their full real selves. I also, so the one that always throws people off here is this cultivating scarcity idea. And for us, that's the idea that like youth, we want youth to feel like we are all in for them, even if there are 12 other people on there. Like it is important for Jayvyn and Shanyce to know like they have my attention and my passion, and that I have chosen to spend time with them. And the other youth will feel that exact same way. Like they have a unique relationship with me that no one else knows, but like we have chosen to invest and pour into them. And I think that's really an important part, that it gives them that sense of power and belonging and connection. And we do find it really important that adult is really consistent, that they know who they're going to see. They know who to text or call when things go wrong and they can't show up. And we know that role as an adult supporter can be a really big job. And so at Patch, we've been working really hard to pay those positions well, those coordinators well, and really invest in the growth and learning of those critical positions. We also know that the adult and the youth adult partnership can really help with community integration. So it can help get youth connected to services in the community, while not being the end all be all themselves, but to really partner across the age gap, if you will, and across the service sectors to really meet the needs of young people. And to me, this has created a feedback loop where we have trusted relationships, So youth like Jayvyn and Shanyce are going to come to me and be like, Erica, this thing isn't working. And we'll say, okay, we'll fix it. Or they're going to be like, Erica, we want to see more of this. And it's like, okay, we can do that. And so because we're having genuine conversations, it's less like pulling teeth when I come to them and say, what do you want to learn? But it's happening naturally and kind of flowing over time. Jayvyn and Shanyce, we'll start with Jayvyn this time, just to flip it up. How have you experienced partnership with adults in Patch or even in other youth programming?
And when you say partnership, you mean like kind of just like the connections I've had with like you or like Jay or like other like just like adults that have come into the space?
Yeah, like what's it look like to you to have a partnership, a relationship with the adults who work with Patch? And maybe how does that feel compared to the other places in which you've worked with you, like adults? Does it feel like you're getting genuine connection with them? Like, how has that meant you want to stick around here versus other places or invest in different ways?
Yeah. I mean, kind of just like going back to what I said, the people, like the adults that I interact with, like in a Patch setting or like something that's related to Patch, like they're all very understanding and like they treat me like as an equal and not like as a there's no like age gap, as Shanyce said, or like there's no like difference in age. It's really just like a difference in like how much knowledge someone has and how much that you can teach them or how much they can learn from you. And I feel like that's like kind of the beauty of the Patch space and like other like youth driven areas is that the adults also want to learn from you and like they're doing as much as they can to show you that they want to learn. And I think that's something that really makes me engage, is that I can learn just as much from them as they can learn from me, or the other way around, like vice versa. Yeah.
I love that. Thank you. Thank you, Jayvyn. And Shanyce, how about you?
Well, one thing that's we focus on in Patch is obviously healthcare and like good relationships. And I think that's really shown through our relationships with our like people that we work with, specifically adults, when we're talking about this. I think one thing that's like sticks out in my mind is like self-care day and how we get to have those days where not only we are paid to be there, but we get to learn like more about ourselves with our like the person that's there with us and like the adult, and like we get to have that moment where we, you know, just have a space to like cool down, relax. And it's just like very completely different from my previous job, where it was kind of what Jayvyn was saying. It's more about that person being your boss and that person telling you what to do, when you should come, like all those different things. You don't get that space to really have that individuality. And I think that Patch really embraces that individuality. And even when we're talking about self-care days, I'm able to talk to my Patch coordinator is Jay, and I can be like, hey, Jay, like, I really want to do this for our self-care day. And like, he completely understands. He's like, okay, that's super cool. And he validates me. And I think that's the biggest thing, validation and what I'm saying, because I don't think a lot of adults do that all the time. So
I love that. Those are great examples by both of you. And even thinking about like the humanity of it. Like, I think the youth adult partnership, Jayvyn, like you asked, like, so tell me what are you talking about? Like, it's the humanity. It's the piece that like, we're real humans in the space. We're not just existing to like check boxes and do a job. And I think what's cool, so I didn't mention this because I'm going to tell you way more about ways to partner with Patch later. But so Shanyce and Jayvyn work on a team of 12 youth total. And so at any given time, a coordinator is not just partnering with 2 people, but has a team of young people in which they're partnering with. And so they are forming these unique relationships and kind of gathering input and conversation casually from everyone across that spectrum on our team that is intentionally diverse and from different areas of the community in which it serves. And so it is really cool to be able to pull that together and kind of knit together a team that is unique and serving the unique needs of those youth in that space. I think, and Shanyce, I think you very clearly took me to the next part of our model for youth engagement that I'm not going to spend a ton of time on, but it's our employment, education, and empowerment pieces of it. Part of it is that youth is a job, so it allows us to engage young people that maybe wouldn't have been able to participate otherwise, because it is a paid job. They are getting money for the time in which they are spending with us. And then it also allows us to uphold expectations. So while Shanyce and Jayvyn have been like, you know, they're not telling me when to be where and what to do and all that, like, we are, but we're doing it friendly, and we're troubleshooting when Jayvyn's like, oh, I'm stuck in traffic, or my Uber didn't pick me up and now I'm trying to find another ride. Or when Shanyce is like, I didn't realize that this thing was this far. Like, is this an optional event or a required event? And so we're trying really hard to communicate upfront what those expectations are, because it's a job. And then we troubleshoot as needed. We hold accountable. We check in and at a mid-year review and say, hey, attendance hasn't been great. How do we fix it? Is this actually working for you? Do you want to do this? And we troubleshoot from there. So I think that's the fact that it's employment allows us to truly partner and make sure that like we are meeting our grant requirements. I know all of you are grant funded in some way, but at the same time meeting the needs of young people. We also educate. So you heard both Shanyce and Jayvyn talk about self-care days and enrichment meetings where they're diving into topic specific things like food insecurity or sexual health or drug and alcoholism, or you name it. And so the youth are gathering that knowledge and taking it back into their communities and doing some informal change work just by learning a little bit more about themselves and about ways that they can engage and connect. And then the empowerment piece is making positive change in the community. So to us, none of these are doing the full power unless they're all happening together. So for us, the empowerment piece is honestly moments like this where we are bringing youth with us in front of groups of people, whether it's for workshops or webinars or for consulting. It's getting youth all the things they need to feel comfortable and confident, and making sure that they have an outlet for that to get their voice heard and out there. And so all of those work together toward kind of our broader healthcare focus, as Shanyce said. And this is a quote from a past teen educator who I think really defines why we do this work that we do in PATCH, which is that managing our own healthcare, like driving a car, is an important part of becoming an adult. At the end of the day, it's just making sure we're physically and mentally well so that we can do so many amazing things in life. So we are really treating a lot of the work that we're doing as an adulthood preparation subject, as a way to get young people ready to start taking responsibility and being engaged in what can be a really hard conversation around health and healthcare. And that they have the knowledge, skills, and confidence to do that. And so that is the foundation I wanted to lay as far as like, what do we do with youth and how do we work with youth? We'll talk more about like, what is PATCH actually doing? That was kind of our theoretical background and framework, if you will, on our model for youth engagement. But I would love to transition into some of our workshop previews. So many of you are focused in on local and tribal health departments. You are working with young people, perhaps providing direct service or education. And one of the things that we love to do is take our young people out into the community and do sessions all about health and healthcare. And specifically, they focus on, well, I'll just go here. Our PATCH for Teens peer-to-peer, for example, we focus on the fact that teens need and deserve a good relationship with healthcare providers. They have legal healthcare rights as teens, and teens have a responsibility to be involved in and learn to manage their own healthcare. And so teens like Shanyce and Jayvyn, I guess you all just did a provider workshop, but they go out into the world and they talk to groups of peers and they say, hey, healthcare can be really cool. I know a lot of us haven't talked about it. And so they are doing the work kind of getting young people to get excited about this thing that we often are like, feels like a burden, to see the opportunity in having a trusted adult in the space, and to really be responsible managers of their own health, because we know if they start now, they're going to do better down the road as they age, and they're going to create healthy habits for that. Is there anything else, Shanyce or Jayvyn, you want to tell us about the PATCH for Teens peer-to-peer workshop? Other things that stand out to you as someone who regularly delivers it?
I mean, I guess I could say that the nicest thing is that you with enrichment meetings is oftentimes you do have adults coming in and like expressing like different types of things. Kind of like what Erica was saying was that we learn about like sexual and reproductive health or drugs and all those different things, harm reduction. But when you get to speak with other peers, I remember I did one with pregnant teens and teens who had a child. And I thought that was very interesting because we don't get to do that in our enrichment meetings, but I not only got to teach them something, but they taught me stuff as well. And so I think even in like peer-to-peer workshops, you get to learn things that, you know, maybe not in your enrichment meetings you get to learn, but you get to learn that like with other peers and people your age.
Yeah, I love that. And I think so much of what you're learning in the workshops then comes back to the enrichment meetings, and what you're learning in the enrichment meetings is going to feed into that next one. So we do try to keep them all related. Yeah, Jayvyn.
Oh, no, you can finish what you were saying. Okay, I was just gonna like kind of connecting the workshop back to people like the site coordinators, because they work with like a smallish group of like 12 people. It's really neat that they can get to learn some really individualistic things about these teens, and then decide like, oh, like maybe I should try to get this person to this workshop because they would have a really they'd be able to give a good perspective on this issue, or they have like some experience that they might be able to talk to this group of providers about and make their all around like healthcare services better for other youth. And I think that's just really cool.
Yeah, I love that, Jayvyn. You really hit on that. Like, we are really intentionally bringing together diverse youth who are going to tell their stories and experiences. And honestly, you all will see it maybe more for the next activity to do. So we're going to do an activity from the Patch for Teens peer-to-peer workshop. And then we're going to do an activity from the Patch for Providers workshop. And I promise we're going to get even more and more interactive as we go. This one is Jayvyn and Shanyce are going to act out skits, and they're going to focus specifically on the responsibility part. But for context, in a workshop with other youth, it's typically 60 minutes. It's typically presented by 3 different teens. And we, at this point, like in the activity we're going to, we would have already talked about relationship and rights in healthcare, and we kind of wrap it up with this idea of taking responsibility. And so we are going to do a couple skits that are going to be perhaps a little cheesy and over the top, but also very real as far as experiences that youth have in healthcare. The hope is really to give young people the tools they need to go out and kind of do this with their own healthcare providers. So Shanyce is going to be our teen, Jayvyn is going to be our healthcare provider, and I'm going to read each tip. We are hoping that Jayvyn has what he needs script-wise because the internet is not working to do downloads, and that we will troubleshoot as needed if there's anything perhaps weird. Y'all ready? All right, let's do some skits for everybody here. Yeah, Jayvyn, what's up?
Okay, so Shanyce, or am I talking first or Shanyce talking first? Because
I'm talking first about do learn your insurance coverage. Is that your first one? Is that your number one?
Yeah.
And then Shanyce is first because Shanyce is the teen, and you're going to be the reception / healthcare provider.
Okay, yeah.
All right, cool. We've also been on summer break, y'all. Like, we already wrapped our programs for the year. We typically wrap up in May, and so these two have kindly come back to join me for this presentation. We good? Ready, actors? All right. So number 1, do learn about your insurance coverage.
Hi, I found this phone number on the back of my insurance card, and I'm calling because I have an appointment tomorrow, and I want to know if it's covered under my insurance and how that will show up on my bill.
Those are really great questions. Let's start by looking at your plan information. Can you read me the number from your insurance card?
Number 2, do ask for one-on-one time with your provider.
Hi, my name is Shanyce. I'm calling to make an appointment with Dr. Taylor. Can I get a longer appointment time than usual? I want to make sure I have enough time to get all the information that I need.
Absolutely. Let me see what we have available.
Oh, and my mom will be coming with me to the appointment. Is there a way to make sure that she isn't in the exam room the entire time? It's just so awkward when she's there.
All right, number 3. Do bring a written list of questions to your appointment.
All right. Good morning, Shanyce. It's great to see you. It looks like we're doing an annual checkup. Is that correct?
Yep, and I also brought a list of questions. I've been writing them in my phone as I think of them because I didn't want to forget to ask. Is that okay?
That's fantastic. Thanks for bringing them. I wish all my patients would.
Y'all are in person now, by the way. You're back in the office visit for realsies. Number 4, do tell your provider everything about yourself, including your activities, hobbies, and feelings.
So, tell me, what's been going on?
I don't know. I guess I just don't feel like myself lately. I just quit the soccer team and my family's freaking out. I used to love it and I know I'm pretty good, but I don't care about it anymore. It's not like I'm going to be a professional athlete or anything. I want to be a doctor.
Thanks for bringing all that up. I know sometimes it doesn't seem like it's important to share, but it really helps me get to know you. Let's talk more about the changes you've been experiencing.
Number 5, do remember your provider may make mistakes. Correct them politely.
Hey, Shanyce, do you have a boyfriend?
No, actually, I have a girlfriend.
Oh, I'm sorry for my mistake. Thanks for correcting me. Knowing you're attracted to helps me provide additional support and services to keep you safe and healthy.
Number 6, do be honest.
You said that you spend a lot of time on your phone. Can you tell me a little bit more about that?
Well, sometimes I get on my phone just to check one thing, but suddenly it's been an hour. To be honest, it's exhausting trying to keep up with it all. Sometimes I end up skipping homework or going to be late to bed because of it.
Thanks for being honest with me. Too much screen time can be bad for your physical, mental, and emotional health. And it sounds like you're noticing some negative side effects from it. Let's brainstorm some ideas so you have more control over when and where you use your phone.
Number 7, do ask for help when you need it.
Everyone else really likes the person that I'm dating. I get flowers all the time and they offer to drive me everywhere, so my mom doesn't even have to. And it is kind of nice to have to get someone to date for homecoming already. But honestly, I'm terrified of breaking up with them. I know that they're going to freak out if they say that they can't live without me. I think I need help with this.
I'm extremely proud of you for recognizing this, that this isn't a healthy relationship. That isn't always easy to do. Let me tell you about this teen support group that meets at our clinic. I highly recommend it.
Number 8, do be your own advocate.
Do you smoke cigarettes?
Yeah, I used to only do it with friends, but I have started to do it on my own too. I'm trying to quit, but it helps me relax.
Okay, thanks for sharing that with me. Do you think this is something that we could talk to your guardian about?
No, I want to keep this information between us.
You do have that right, but sometimes it's helpful to have a support person involved if you want to quit.
Thanks for that suggestion, but I want to hear some other options.
Number 9, do write down what the provider says.
It sounds like anxiety is really starting to interfere with your day-to-day life. Luckily, we have lots of options for managing anxiety. One that I would probably recommend for you is...
I don't mean to interrupt, but do you have a pen and paper? I'd like to write this information down.
And number 10, do ask for more information when you don't understand.
All right, here's that prescription. All you need to do is go pick it up later today.
I'm not really sure how to do that. My mom always has done that for me. Where am I supposed to go? Do I have to bring anything with me?
I'm so glad you asked. It looks like your prescriptions are sent to the pharmacy on First Avenue. I can print out the address, phone number, and directions for you. Then you can call ahead and see what information you need to bring. They might ask for an ID or an insurance card. You may have to pay a copay when you pick it up. Let's walk to the printer and grab the info before you leave.
And woohoo, big round of applause for our wonderful actors with their vignettes there. I do again know it's a little bit out of context, but the hope is really that the teens that are in the room with Shanyce and Jayvyn or other teen educators realize that they can talk to healthcare providers about just about anything. They can bring it up, they can see what happens, and then they can have some language and tools for ways to respond when they really need help, or when they're like, you know what, nope, I've got this one. I want this to stay between us. I have that right. So phenomenal job, actors there. I also let them pick earlier. So this might be Shanyce's last time acting as the teen. So like, where do you want to go with it? I know, graduate. So that's our peer-to-peer section. And again, it's typically 60 minutes and much more than that, but we wanted you to see some of the ways we're encouraging youth to start engaging with those of you who are healthcare providers. And, or if you're not a healthcare provider, perhaps you can give some of those tips to the young people you work with. The second section that we're going to go, I'm actually going to, after this, stop sharing my screen because we're going to ask you to participate in the chat. But before I get there, our Patch for Providers workshop is a direct complement for our Patch for Teens peer-to-peer, because it's not all the teens' responsibility to get them the healthcare they need to deserve, right? Like providers and healthcare systems need to be part of this too, and adults who work with young people. So we do a 90-minute Patch for Providers workshop that again focuses on those same R's. Healthy patient-provider relationship is built on good communication, respect, trust, and honesty. Honestly, this is a part that we spend a very big chunk of time on with providers. It's just how to form a relationship with young people, because that age gap can feel really hard. Like we know that is not always intuitive, and that the world of young people is changing so rapidly. So we spend a lot of time there. That's why Jayvyn and Shanyce are so important too, to be like, here's what's happening in my life and in my peers' lives. We also talk a lot about all people, including teens, should have legal healthcare rights and should be reminded of them at each visit. So many young people don't know this. And then providers have a responsibility to educate, engage, and empower teens to participate in their healthcare. So it's a team dynamic. We have things, expectations of youth and of the adults who are working with young people. The goal is really to improve the quality of care youth receive when they are seeking services. So when they are coming to the place that you work, and this one would be awesome. We would love to do a 90-minute session with the folks in your clinic. So we'll talk more about that too at the end. But Jayvyn or Shanyce, anything you want to add about the Patch for Providers workshop experience or the workshops themselves?
I mean, for me personally, I guess just like kind of getting out, and I know there was this one specific workshop. It was where we were talking to pharmaceutical pharmacists. That's what it is, pharmacists. And like I just found it really interesting to kind of learn about a career, something that I never really like heard about. Like obviously, like I've like interacted with them before and like know what they do, but like I just never really like heard how it really is to like be in that career. And I just like think it's like a really interesting opportunity to not only like teach providers about things, but also just learn about like the occupation in general and like just, see that stuff.
Totally. I feel like often we end up framing this as like a workforce development opportunity because we have folks that come in and are like, hey, I have no interest in medicine, or I have interest in medicine, but all I really know medicine to be is doctors and maybe my nurse. But we try really hard to define that quite broadly so that folks like Jayvyn can learn either about pharmacists and be like, ooh, what is this job that I've never thought of before? Or, wow, this pharmacist is a person I could go talk to. I had no idea what that meant. So yeah, it's a really cool way to connect there. Thank you, Jayvyn. Shanyce, how about you? Any other thoughts?
Kind of just adding on to what you guys said, like I think with providers, we get to like meet them on all different stages. So they could be studying to become like a doctor or OBGYN, or they're actually currently a gynecologist or a dentist. So we get to meet them in different spaces or different parts of their career. And I think that that is really important, especially when you meet them at like the beginning of their career, because you can like help them to implement that when they are finally, in a clinic, but also those who are already in the clinic can use that and fix or maybe keep the way that they're talking to teens. And yeah.
Yeah, I love that. And honestly, it reminds me, so we were talking earlier about that youth adult partnership in Patch itself, and we are aiming for a level playing ground in that. And I think the Patch for Providers workshop is kind of cool because it kind of pushes that even more and flips the power dynamic, because so often young people show up in healthcare spaces and think that they just have to fully trust the adult in the room no matter what. They have no power or choice in this matter. And so then we take this room full of providers and say, you're the learner and these teens are the experts at this teen thing. Like they are living it and breathing it. And so it is honestly one of my favorite parts of our program. It is just so powerful to see that dynamic shift, to see providers get to learn together too. I think that's a gift of time that providers are not often given. You all have so many expectations on you that it is kind of a really cool way to come together. So in this moment, we are going to talk about the rights section because I think it's kind of just a fun way to interact with you all. And I'm going to stop sharing my screen. So you should be able to see our faces. And I'm going to copy and paste some things into the chat. But we're doing Keeping It Confidential, Jayvyn and Shanyce. Jayvyn, I have you starting with the introduction to the activity, I think, from the get-go. And I'll let you, I guess, run the activity and I'll jump in as needed. But all of you there in the audience, get ready to participate in the chat.
So the troubleshooting thing. Are we at the top of the page where it says Keeping It Confidential in the blue? Or no?
Start, it says all people, including teens, Pete. Does that help?
Oh, okay. Okay. All people, including teens, have legal healthcare rights and should be reminded of them at each visit. This is one of the most important things to remember from today.
As teen educators, we have learned that there are laws to protect our privacy. These laws are really important as we grow up.
They're also important because teens are less likely to tell the truth or get follow-up care if we think other people will find out.
We know confidentiality is one of the most confusing parts of providing us care. So in this activity, we're going to talk about some of the things you should know to better respect our rights.
All right. Grab your emojis.
Get ready to participate in the chat. Yeah, that's the biggest thing. Shanyce, do you want to give the instructions on this part?
Sure. This time I'm going to read 5 statements. After each statement, write a word or emoji that best represents your thoughts or feelings, just like before in the chat. So after you
The
respond,
transition for virtual.
okay, yeah. After you respond, we will share some of our thoughts. Is everyone ready in the chat?
You're good. I see head nods.
Yeah.
All right. Number one, teens have a right to confidential healthcare.
Take a minute, use your emoji response, type an emoji in the chat. I love that there's emoji options here now. Give us a word that feels like it describes how you feel.
Okay. A lot of positivity.
I think a lot of thumbs up. I thought some hearts. But that one's pretty easy. Let's try the next one. Number two, teens understand they have a right to confidential healthcare.
Will you read it one more time? I just put it in the chat so folks can catch up. But
All right. Number two, teens understand that they have a right to confidential healthcare.
and some clever ones coming through already.
Oh,
The monocle one really got me.
Teeth gritting. Well, many teens do not know they have right to confidential healthcare. In fact, most of us didn't know we had any rights to privacy until joining Patch. And when we do workshops with teens, a lot of them don't even know what the word confidential means.
It is your job to make our rights to confidentiality very clear every time we see you. Tell us about our rights and why we have them. This will help us understand why we should trust you and tell you what's really going on in our lives.
Today we won't go into federal and state laws about confidentiality and consent to care. They can be pretty confusing, and honestly, we don't claim to be experts at the law. We're experts at being teens. But as an example, all 50 states allow us to consent for STI services, and many we can consent to reproductive and prenatal care, and in some we can consent to counseling, mental health services, or alcohol and drug treatment programs. If you do have any questions about the laws, please talk to our site coordinator. They know a lot about this stuff, or Erica in this case.
Here are 3 tips that we think might be helpful. 1, use a confidentiality contract to help teens and their parents or guardians understand this important part of the patient-provider relationship. 2, clearly explain what service we can consent to for confidentiality. And 3, tell us what is not confidential upfront.
As teen educators, we understand that many of you are mandated reporters, and our safety is your biggest concern. A lot of our peers do not know what mandated reporting is or even how it works.
Some teens can be really hurt if you share personal or private information without telling them. If you do have to tell someone else about information we share to keep us safe, let us know what's going on and make sure we are prepared. We do not want to be caught off guard. On to the next statement.
Number 3, if a support person, such as a parent, partner, or friend, comes to an appointment with a teen, they should be allowed to stay in the room for the whole visit.
Back to those emojis or words. You all found the emojis and seem to be having fun with it. So those emoji pieces.
Side
What
eyes.
do we think? Oh, the cleverness.
Stamp out.
This is
Thumbs
way
down.
more options than we have in in-person workshops. It's a gift of
So
the virtual
true.
space.
Yeah.
Well,
This can be very tricky. We value our privacy, but we also need support.
let's talk about our partners and friends first. You may be excited to see us with a partner when we come in because it shows that we're having a mature relationship and are taking the next steps to staying healthy. But even if we arrive with our partner, we may not want them there the whole time.
It is the same with our friends. They can be a really important part of our support system and may help us get to our appointments or encourage us to take better care of ourselves. But even with our best friends, we may not always trust them to keep our information private.
Be aware of power dynamics that can change the way we behave or the information we share. Make sure we have at least some one-on-one time together at every visit.
Now, let's talk about our parents and guardians. We know it's important for parents and guardians to be involved in our care. They can be a great support system during tough times, and their consent is needed for really important things like the HPV vaccine or treatment for anxiety. They also may be paying for our health care.
But many of us will be more open and honest with you if they are not in the room. Some of us even lie or not tell the full truth if someone else is with us.
We need you to be the one who makes that one-on-one time happen. After giving our parents and guardians an opportunity to share their concerns, politely ask them to leave, no matter the reason for the visit.
This is really important for telehealth visits too. Make sure we've got time with you without our parent or guardian in the room. And if needed, help us brainstorm ways we can get privacy even if we're in the same space.
We understand how awkward and challenging it can be to ask someone to leave a room. So at the end of this section, we'll watch a quick video and share some tips that might help. Are we watching the video? No. Nope.
In person, we do give providers actual tips on like how to do that because we know it can be awkward and challenging, but we're not going to get there today.
I do have one thing I want to say though. It's a little harder to emphasize when kind of just like reading it. But being more direct with like people that come into the room, like parents and guardians, like saying like, okay, can you leave the room now? Instead of like, do you want to leave the room? Or is it like making it more of like being aggressive and saying they kind of have to, but in a polite way. I think that's what's needed, not like asking them.
All right.
Moving on to statement 4.
Right. All right. Do you want me to say the statement? Because it was like kind of all wonky, but it's okay. Number 4, once offered privacy, teens are likely to open up about more personal or sensitive topics.
And we're back to those emojis too. I feel like it sneaks up on us. We have such good conversation. Oh, we're feeling lovely about this one. Something about getting this starry eye just like makes me feel better as a human. Just like, oh, that feels great.
Yeah, everyone, it's like much more positive than before. Even when our support person has left the room and we have been told that about our rights, we still may feel uncomfortable.
We have been lectured at school and at home about drinking, sex, drugs, and on and on and on, and expect the same from you. To help avoid awkward silence, let us know why you're interested in our behavior. What is the clinical reason you are asking these questions? It helps to know you're not there to yell at us, but to provide us treatment and help us make smart decisions that will keep us safe.
A great approach to using the heads model is start with questions about home, education, and activities before moving on to more personal topics like drug use or mental health. Even in a short visit, this can help us gain comfort and trust as we are allowed to open up to you more slowly.
All right, it's kind of quick. We're on our last one. Number 5, keeping information confidential is in your control.
Last formal emoji chance too. Oh, I forgot to copy and paste it. Will you repeat it? I was not onto my game.
All right, number 5, keeping information confidential is in your control.
Thank you, Jayvyn.
Smiles, thumbs up. Angel, yeah. We've already talked about this a little bit and understand there are times when we don't have rights to privacy. In these situations, we hope you have an honest conversation with us about our options and help us talk with our parents or guardians if needed.
Other times, confidentiality may be broken from health system practices like insurance bills, explanation of benefits, medical records, automated notification calls, or satisfaction surveys.
This is probably familiar to you. But many teens don't understand how this all works. If you think something might happen, let us know who could find out about our visit and why.
We also appreciate any extra effort you make to prevent our information from being shared. For example, you could make sure you have our contact information and not just a parent or guardian.
Or be intentional in your medical coding and consider coding for symptoms and clinic findings rather than a diagnosis. This may give us extra layer of privacy when items show up on insurance bills or explanation of benefits.
If you are really worried about our privacy, refer us somewhere else in the community where we can get more confidential care.
Side note, if you do refer somewhere for any reason, make sure someone from your team follows up to see how it worked out.
No matter what, be open and honest with us. Tell us that you will do the best you can to keep our information private and explain that some things are out of your control.
We hope this helps you to understand how important confidentiality is to us and how much we value your extra effort in protecting our privacy.
Yay, and another round of applause for the teams taking on another section of our Patch for Providers workshop. So again, we do wrap that information around with like this idea of how do we build relationships, as then we contribute to the right section. And then how can providers do some of those really hard things, like ask a parent or guardian or partner to leave the room in a way that like respects that autonomy. And we also try really hard to prep youth that like a provider might ask a parent or guardian to leave the room, because we know that that's really anxiety inducing. We know that not everybody has trust in the healthcare system. So we're trying to help build up trust in a variety of ways by starting early and also empowering youth to know that like if a provider asks somebody to leave the room, it's because they can't look at Jayvyn and say, I bet Jayvyn's fine with parents or guardians. We're just going to let that happen. But Shanyce's parents got to leave the room. Like, that's weird and not fair. So we try to communicate that to youth so that then though, if a parent or guardian leaves, but they want them to come back, they can immediately like, but would you bring them back, please? Like, I actually really want them here with me. But if that wasn't the case, that teen still gets that opportunity. I'm going to share my screen once more for a moment and tell a little bit about how to move forward from here. Like, we've given you kind of just like tiny tidbits of what we're all about at Patch. And then the last thing we're going to do is a Q&A with Jayvyn and Shanyce. So once more, round of applause for their acting and script abilities. I will say they follow a script and then build in their own stories and experiences as you saw throughout, which is the power of making sure all providers get the same education, but have a slightly different experience throughout. And forgive me, because I'm actually going to go back just so quickly, because I want you all to see when we say a confidentiality contract, we have a sample pocket card like this that I'll make sure we send out. And so it's just kind of this is, as a provider, what I promise as far as confidentiality goes. I promise those a chance to come back to it. And then this is what we're talking about with the HEADS model, that stands for home, education, activities and alcohol, diet and drugs, self-esteem and sexuality, safety and suicide. There are many models like this that are about taking a health history. This is one we really like at Patch, with some examples of youth-friendly language and ways to ask these questions that isn't, you're not smoking, are you? But is instead perhaps a little bit more welcoming and allows them to actually answer truthfully. So there's both of those. I'll make sure we send as follow-up. So let's talk about Patch after that great work of the teens. All of our programs here in Wisconsin are part of our Wisconsin Patch Collaborative. Jayvyn and Shanyce both introduced themselves as teen educators. And our teen educator teams are here on this right-hand side. They are all home-based in a city hub where they pull youth from kind of a county area around them. And then they serve the full region. So no matter where you are at, we have a Patch team of teen educators that we would love to connect you to. It might be that they travel to you. If you want to do workshops with us, they can travel, or it might be that we explore virtual options, because we do virtual workshops. But I mostly wanted you to know that no matter where you're at in the state, just because I said I'm in Madison and Jayvyn's in Middleton and Shanyce is in Sun Prairie does not mean that we only serve our tiny little area here. But we have a team of teen educators in Wausau, Green Bay, La Crosse, Madison, and Milwaukee. And again, they travel and move around. And so there's lots of ways to partner. And if you want to connect with your more regional site coordinator or more regional coordinator, just send me an email. My email's on the last slide and we'll connect you with them. We also have a statewide teen or youth advocacy fellowship that hires youth from across the state, even if there is not an in-person team near them. They all come together once at the beginning of the year to get trained, and then they work virtually on advocacy projects and consulting. So it complements this healthcare work, but kind of expands the health piece a little bit more. So we are doing a combination of in-person and virtual programming, and are really able to serve many of the youth voice requests or needs of the adolescent health workers like yourselves from a variety of sectors, really. This is our teen educator program, one of the two programs we run. The teen educators are local teens ages 14 through 18 who are hired. And again, they are trained and they function in person. They meet 2 times a month to learn about health and that ongoing education and empowerment. And they deliver the 2 workshops that you just saw, basically in their entirety, in a variety of spaces and settings. I think they already told you even some of the providers they work with and some of the youth groups they go to. We would love to schedule workshops with you and your team. So if you work with young people in your community and you think you want to get them the education, hit me up. We got you. If you have a group of providers, I know many of you are working on improving youth engagement and adolescent health in your unique department. If you want to have a session with your coworkers who maybe couldn't attend today, or you want to see all of it, let me know. We can figure that out and make those connections for you as well. We would love to find a way to partner. And I do think the workshops are just a really powerful way to start the conversations. They are very much a 101 and a place to build from, which I really enjoy. And then our other main program, as I mentioned, was the Youth Advocacy Fellowship. These are youth ages 13 to 19 who are part of the fellowship model. And their meaningful impact instead of workshop is engaging in community advocacy projects through a learning series. So they are learning their own advocacy skills, how to create change in their community, and trying to take on a project it could be their schools, is where a lot of them are defining as their local community, but it might be their neighborhoods, it might be their city or something else like that. And so they are creating change in that way. And then they're participating in consulting sessions. So if people are working on a project that impacts youth, if they want to create a campaign, some kind of awareness campaign, if they're creating a curriculum, all kinds of things, as you can see here, we can bring together a team of young people who are well supported and trained to deliver really quality feedback. And we can pull those youth voices together and get you feedback. And we have really been found that when they're allowed to consult as a team in their own space or space they're used to, i.e. their virtual Zoom space, with their trusted coordinator, their feedback is really more authentic and their true passions shine, and what you get is more quality. And we would love to consult with you all. So as you are working to do youth engagement or youth partnership or connect more with young people in your community, hit us up again, let us know. We can definitely pull together groups of youth for a variety of projects. And then we have our patch toolkits. Apologies for the blurry image. These help educators or adults in communities, maybe where there's not a teen educator program. So we again are happy to travel. We're happy to come to you. And we know that our Madison teens are not always the trusted messengers in certain communities, or, our Wausau teens, if they're traveling way up north, may not be the people you need to be delivering education to youth in your community. And so we've created these toolkits that basically complement the Patch for Teens peer-to-peer session and allow it to really just expand reach in case there is not one from Patch available. My quick caveat is these are currently under quality improvement session because we are going to make them so much better. These are they were video based to get teen voice in there still, but I think what we've really learned is it's about the conversations youth are having in the room. They don't have to see our teen faces on there. And so we're trying to make them low tech, super easy to use and read, and actually accessible to anyone, because right now they're available for fee, but we're trying to make them free online in kind of more accessible chunks. So that I'm hoping by August to have ready to launch. I can get information to Jen, who can then pass it along to you all when that's available. And then we also have our complimentary Patch for Parents facilitator guide that we know that the triangle in getting youth the healthcare they need and deserve under the age of 18 does not just include the provider and the teen. There's a parent or guardian often in the mix in some way, shape, or form who is helping teens develop skills, who also is a little nervous about youth growing up. That's a scary period of time in life. And so we are trying to give a resource that people who work with parents can help prepare them, honestly, to take control of their own healthcare, because we know a lot of adults are not trained in that as well. And to see why it is so valuable for you to start having these, specifically the one-on-one conversations, to start building trust, to start getting the healthcare they need and deserve. That toolkit right now is still available. It is still in pretty good shape. It will eventually go through quality improvement, but if you're interested, just let me know and we can figure out a way to get you access to that Patch for Parents as well. I love where we got it. We piloted it with folks right before the pandemic. And so it's not been used widely, but it has some really cool content and ways to start that conversation as well. The other thing I will say is we just have a ton of resources. We have some that are available to purchase, so brochures and things that are really great to have in clinics, in schools about, guide to confidential healthcare in Wisconsin, getting the healthcare you need and deserve, a teen's right to privacy for parents and guardians to just kind of think through what that means and looks like. But then we also have posters that you can download and print with confidentiality contracts or tips for teens, letters, things like that. A lot of them are available online. Many of them are actually available in Spanish as well. And then one of the biggest things, I guess, that we also offer is coaching with Patch staff. So I am here because I am our director of youth engagement, and the gift of my role is that I get to not only work with these awesome teens, but I also get to work with the adults who work with young people to help them better engage young people, to help them troubleshoot when we learn that Jayvyn's like, I just can't get there on time any of the day. Like, how do we troubleshoot that? How do we like let other teams know, like, how do we just figure that all out? And so we troubleshoot, we figured out, I help other adults do those things. Jayvyn, sorry, I'm picking on you. I'm not actually picking on you. Jayvyn's wonderfully responsible and phenomenally communicative. But so I help people troubleshoot when there are things that are coming up, or just brainstorm recruitment of young people. I think sometimes getting them in the door is a really hard part. So you can connect with me or my boss, Amy, our director and founder of the program. And that's one of our other resources that we offer and are excited to partner with you all, because that's kind of it's a new capacity for us at Patch to be able to truly coach folks as well. So we're excited. I think your group is one of our first that we'll really be diving in with. And this is, I'll pause here for our websites and social medias and my email address there at the bottom. And I think that brings us to Q&A, which I'm baffled and never this on time for things. So we've got 15 minutes or so to meet your needs as an audience. What I would say is especially what you want to hear from Jayvyn and Shanyce about working with youth, but also if there's anything you need from me. Knowing that's been up for a little while, I'm going to stop sharing and see what comes up. Oh man, you all weren't seeing my slides.
Yeah, I saw your slides. You just unshared.
Oh, okay. I got a note at some point. We're good. I probably got it and then stopped seeing. We're good. Thanks. What questions y'all have? Yeah.
We have one in the chat. Jayvyn and Shanyce, great to hear why you joined Patch. Can you explain how you learned about Patch and how we as adults can reach out to kids to join?
I can kind of say something about it. I think when it comes to joining Patch, I feel like people kind of join for a lot of obscure reasons that I've heard. And for me, it was because I was kind of looking for a summer job, it's the kind of the opposite of a summer job, actually. But I was talking to one of my school social workers because I had just moved to Middleton. It was like a whole new environment. I went to a really small school, and like, I don't know if any of you know, but Middleton High School is the largest high school by population in Wisconsin, or public high school now. So it's just completely different change. And so obviously I was talking to the social worker, you know, just like, I guess coping, but like, it wasn't in a bad way, just like trying to like get a feel for this new environment. And it's more of to like, she showed me, or like told me what Patch was about, and like obviously sent me the email. But it's more of like how she was kind of a great like provider, and it's not necessarily healthcare, but a lot of the things that you learn that you can learn from Patch, or that I've learned in Patch, can apply to like what a social worker does. And I think she really hit the mark on a lot of the things that we try to get healthcare providers to do and be better with their practice about. And I don't really know where I was going with this, but just a great social worker paved the way for me to come to Patch, and now I'm hoping that a lot of other providers will end up like the social worker that helped me get here.
I got into Patch because my mom works at public health, Dane County / Madison. And her coworker, Jill Denson, was like, your daughter should do this. And she let me know. And at first I'm like, my mom was like, you should do this, because I was like very involved in like different types of social justice things previously. So I was in my like school GSA, and I was in BSU. And so she was like, you'd be probably interested in this. And so I like tried it, wasn't really expecting anything, to be honest. And I was like in for a rude awakening, because it was like so much fun, like just really eye-opening. And it really showed me that like I didn't have to like I could learn. There's so much that I did not realize that I did not know about, and so much for me to learn. And it was just like amazing and stupendous.
I love it. Yeah. And honestly, so Jayvyn and Shanyce are often how you find us. Like, it is adults who have formed good relationships with young people often tap them and say, I think you would be good at this. And we often try really hard to get youth who maybe weren't involved in things like this before. Youth find us and don't actually know what they're doing. They're just like, I want to get paid. And that is an appeal to them. And we also try to make it a really accessible application where youth get to not like prove that they know all the things, but actually like tell us about who they are as individuals. And so I do think if you are even like your own group of young people, if you're trying to recruit that idea of like, tapping the adults who are working with youth in a variety of sectors. I'm always shocked how many people find out from their pediatrician who is like telling them to do this thing, like that they are learning from their social workers, their care providers, their club leaders, like they're on the lookout for us, which I don't think we could recruit as quality youth as we do without the other adults that see the potential in these wonderful young people. Right now, as far as youth joining Patch, if you all have people in your area, we just closed our application period. So we actually recruit through the end of the school year up through like the first week of summer, and do the application process, but keep an eye on our social media because we relaunch every spring to join a Patch team. And there's also some things we're kind of exploring on how to better support you all in your own groups youth. So they don't have to be Patch youth, but they can maybe get some of the experience of Patch youth by participating in co-presenting those toolkits, the Patch for Teens toolkit. We've explored other ways to kind of do youth engagement, and so can always coach on that end too.
That brings up a good point, Jayvyn. I like how you said you had received it from a school counselor, is that we did send out all the information in the newsletter around Patch. So keep in mind, you can definitely send that to your networks along with, links, whether it's healthcare providers, schools, whatever that looks like for you guys. So please share so that you can also hear about it.
Thank you. Thank you all also for helping. It's also partnerships like this that are able to like get it to wider networks, because we do often have one adult working with para youth in one community. And so we need word of mouth.
What does Patch do around mental health?
Jayvyn and Shanyce, do you want to talk about it?
Sure. I can talk about it. Well, going back to what I was talking about before, a lot of things are centered around self-care, I will say. Like I said, we had like days where we get to come around and like, hang out with one another, because sometimes we're just doing enrichments, we're just learning, and we don't get a chance to really hang out with one another. So we have self-care days. On top of that, when it comes to enrichment meetings, sometimes we do have people coming in who talk about like things surrounding mental health. And like, since mental health is such a broad, like, term for like many different things, it can go in as like depth as like relationships and how that like affects, or like with mental health, or just like different, or even if we're talking about racism or something like that. Sometimes our enrichment person who's doing the enrichment meeting might also delve into how that may connect with mental health. So it really, I would even say that mental health kind of always is a constant within Patch meetings, and even how we take care of one another who are in our teams, or even our Patch coordinator. So yeah, that's what I would say.
For Patch, I feel like if you're talking about within Patch, I think a lot of like workplaces will say, like, will preach like mental health is important, right? But there's no like really way to apply it to the workforce, or like within like where like your area, like your job. But like with Patch, it's like we know that mental health is already important, so it's just like it is what the process is, or it is what like the job is like. You're like, the adults in the space are very like cognizant and like understanding and just like aware of things that happen, and like mental health isn't something that only affects like youth, it affects everyone. So like knowing that like that is back and forth, and it's like a reciprocated understanding of like when things happen, like this is like there's no need to freak out about things, and it's just like it is Patch. It's like it's not mental health isn't something that like we need to preach. It's just something that should be incorporated into the way we live. But when you talk about what does Patch do for mental health in a stance of like for workshops, I would say it kind of follows the same thing as that. Like Patch is very understanding as a group that like instead of preaching that mental health is important, it's just like you follow through with it within the way that you teach things. And like maybe it might not be explicitly said, but like letting someone, like when we talked about the provider being a little bit more aggressive, but like in a polite way of asking the parent or guardian to step out of the room, that's really and like in retrospect, like helping the youth out to allow them to communicate their needs without the fear of like judgment from their guardian. which in the end is like bettering their mental health, because those are things that they can actually share with their healthcare provider and not like worry about on their own time and actually receive help for. If that kind of explains anything.
You two are brilliant. The only thing I will add as kind of further clarity is that, so at Patch, we are a healthcare communication program. We do not tackle any specific health topic in our workshops and everything else. Like, it is truly peppered in. So like we'll talk a little bit about mental health over here. We'll talk a little bit about sexual health, talk a little bit about healthy relationships and drug and alcohol use. So like anything that we are actually hearing our youth say is gonna make its way into a script. We talk about LGBTQ health. That changes drastically. Like, I think even so, Jayvyn, the reason we were worried about some of our challenges, and so Jayvyn's working off of last year's script and we make tiny updates, and it seems like, Erica, no one is smoking cigarettes, everyone is vaping. And so like, yeah, you're right. Like that is where we should be like, hey, are you vaping? Do you vape? Whatever. And so youth are telling us the things that are happening in their lives, which are then making it in part into the script, but also that is also why we hire youth to be the voices of that, to say, this has been my experience seeking mental health care. And let me tell you how hard it was, or how great it was, or why my therapist let me open up. And so it is true that we are not the experts in any of the things except bringing youth voice in a really equitable way, getting providers and youth to like connect across that, and just like destigmatizing conversations about health, because what's hard to talk about for one person is really easy for another, perhaps. And so, yeah.
Erica, can you talk a little bit about some of the coaching I know you said it's new, that you might be able to provide maybe some of the local tribal health departments around including that youth voice in an equitable way within, whether they're starting an advisory team or they have youth involved in their work or whatever that might look like in their community?
Yeah, I mean, I think a lot of the coaching and things I have done is even like establishing structure. It can be really hard. I think even like as I'm talking with Jake and Jen, we're getting ready to pull together a group of youth and we're like, do we preset the meetings? Do we let everybody vote? What's that mean? What's that look like? And so I think honestly, like having genuine conversations about like what's worked for us in our experience. So I've been with Patch for 8 years. I have been a sex educator for far longer than that. I've been in this youth work field for a very long time. And so I pull from my experiences, and I coach people across the state of Wisconsin as well as in other states who are doing Patch. So from all of their experiences, I'm able to kind of pull that together and be like, well, this is what I've seen here and it worked really well. Or this is what I've seen 5 people try and we've all failed miserably. You could be the magic 6th person, but also just know that these are the things that are hard. So I think honestly setting up structure and schedules and things like that. I think communicating with youth, I think often young people are you all are communicating in a lot of different ways. And so it's trying to figure out and troubleshoot what are the best ways to connect with young people to like both set expectations and help them develop skills with checking emails, but also it's totally cool to text. Like we connect in different ways, and what's that mean and look like? I think honestly, a lot of it is in supporting youth to be engaged. It's getting creative. Honestly, it's like troubleshooting creativity, providing ideas perhaps that you haven't thought about or in a different way. Honestly, even like troubleshooting how to pay youth, because we know that paying youth is hard, just based on these structures that exist in our departments. And so even troubleshooting things that might or might not work, asking some of those questions. Honestly, I think if you want to work with young people and you just like have questions, that's generally my go-to. I guess the other, I'm trying to think, I'm in the process of developing all kinds of coaching resources. And in my moment, I cannot list off a single thing, but I know even like I'm talking with programs about sustainability and youth work and how you build out a program that will last for a while. Is often reactive to what the person needs, really, because everybody's at a different comfort level. Yeah.
All right, thank you. Are there any other questions that anybody has, either in the chat or feel free to come off mute? All right, well, thank you so much, Jayvyn and Shanyce and Erica, for being here with us. It is so refreshing to have youth here to be able to share their voice with us, and we really appreciate you. Thank you so much. All right, Danette, do you want to move on to some of our closing pieces?
Absolutely. Yeah, I just absolutely cannot thank you enough as well. And I really look forward to our ongoing partnership and connection, getting to know all of you more and learning how we can all work together to help support our local tribal health departments. There's been a lot of behind the scenes work that has gone into their efforts. So thank you, Jen and Jake, also for that. Just a quick reminder of our office hours. Again, I told you I'd tell you again. So in July on the 13th at 9 o'clock, we will be focusing on that youth engagement evaluation tool. If you have specific questions that you would like to make sure that we address during that time, please send them to us at our youth health email. Mark your calendars for our office hours that take place always on the second Thursday of every month at 9 o'clock in the morning. So, and again, we'll announce those topics as things sort of come to the surface. We want to be really responsive to needs, and we've said that a few times. So please continue to share thoughts and ideas with us as well in your evaluation feedback on how we can support your work in that space. Jake, I'm going to turn it over to you to talk quick about the newsletter before we give them our evaluation.
Awesome. Thank you, Danette. So yes, another edition of the newsletter will be coming out this Friday, June 30th. And I'm hoping, just with the timing of everything, that this recording will make it in there. And as always, we would love to hear from you and feature some of our local and tribal health departments and some of the work that you're doing. It doesn't have to be a massive project or major undertaking, just some ideas that you may have or things that you've been working on or have had some success with this year so far. So we appreciate any engagement that you send forward. And as another reminder, our email is youthhealth@extension.wisc.edu. I'll paste that in the chat one more time. But that's the quickest way to get in touch with us and for those technical assistance, as well as sending over some highlights with your work. And if you haven't added it to your kind of safe senders list, I know there can be some strong spam filters at different departments. So add that to your safe sender list just so it doesn't get thrown into junk if you haven't had a chance to do that yet. But I think that's it for the newsletter.
Great. Sounds good. Thanks a lot, Jake. Our next learning community call will be September 25th. It is hard to even think about September at this point, but it will be here before we know it. Our topic for that learning community call will be incorporating adolescent well-being into the CHIP-CHA process. So stay tuned for more information about that. And on that note, we're going to pop up the QR code for our evaluation. Again, please provide clear and honest feedback to us. Any suggestions or ideas that you have are always welcome. Again, we are seeking to be as responsive as we can to your needs and your requests as well. So go ahead and scan that QR code, or I believe follow the link in the chat as well. And we look forward to seeing you again in September and continuing to hear back from you on ways that we can support you in your work. I hope to have a great group in July. And again, we'll continue to share more about our partnership with Patch and how all of you can engage with them and how we can support your learning regarding adolescent well-being and youth engagement as well. Thanks, everyone. I hope you take good care of yourself. Have a safe and happy 4th of July weekend and weekend as well. Take care, everyone. Thanks for joining us today.